Hey, Dan, what's up? You look a little perturbed.
I'm not sure what to make of this, but maybe you've heard that film producers in the United States have made a slasher remake of Winnie the Pooh. It's called Winnie the Pooh, Blood and Honey.
Oh, come on.
No, I'm serious, man. The copyright on A.E. Milne's original stories have expired. So now it's all in the public domain, and now everything's getting a remake, in whatever violent, bloody vision the filmmakers have. So now Winnie the Pooh and Piglet, upset that Christopher Robin has left the 100-acre wood, that he's gone to college, they go on a violent rampage.
Wow, that's really horrible.
Yeah, well, Winnie the Pooh isn't the only beloved character that's getting a cheesy makeover now that it's in the public domain. Apparently, Bambi and Peter Pan are expected to get R-rated makeovers, which got me thinking...
Oh, Niigaan, I don't think I like where this is going.
No. Hear me out here. So you know how, for our podcast, we have the person whose name shall never be mentioned?
You mean Tonto?
Yes, Tonto. Okay, so we all agreed Tonto would be our unseen, unheard passenger on the pod. Well, what if Tonto found out that we had excluded him from the podcast and then went on his own bloody, vengeful rampage? Of course, the first person he would kill is Adam.
Whoa, wait a minute.
And then he would systematically start knocking off all the people who helped make the podcast happen. Free Press editor Paul Simin would definitely have to go. And then he'd start going after us. It would all end up in a dramatic, bloody showdown at the CJNU studios beneath the Fairmont Hotel. We could call it Tonto, Black Mask, Black Death.
That's some idea, Dan. Honestly, I'm torn between calling an agent to sell this idea some Hollywood studio and trying to find you some help to work through some stuff.
Isn't there a way we could do both?
The Winnipeg Free Press proudly presents, in partnership with CJNU 93.7 FM, Niigaan and the Lone Ranger. Here are your hosts, Niigaan Sinclair and Dan the Lone Ranger Lett.
Welcome, everyone, to another episode of the Niigaan and the Lone Ranger podcast, the podcast they said could not be done. And we just keep on doing it.
We keep on doing it, and actually people say that it shouldn't be done.
It shouldn't be done, that's a whole different conversation. But we've been doing it long enough and really exposing people to it on all kinds of different platforms that I think it's time for our first ever regular segment, Reader Mailbag.
It's
Viewer-listener mailbag.
Avalanched, and you think to yourself, nobody writes letters anymore, and they would be right.
Well, yeah, I mean...
They write emails, and they send voice messages.
Yeah.
And they...
and tweets.
Still workshopping the name of the feature.
Yeah, no, that's right. Yeah, and there'll be a theme song, just kind of like one of the late-night talk shows, Did you know, you can do a theme song using the chords to Wild Thing? You can just, you can make any theme song. It's like, reader mail, dun, 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 dun. Dun, dun. So I can do a million of those.
I'm very excited to hear our potential theme song for every segment that we do. But the tweets, for example. I mean, we've been getting lots of great feedback from people. I mean, one of the tweets that I think we got this week was really a positive one, in that there aren't a lot of podcasts talking about Manitoba politics. Isn't a lot of podcasts with Indigenous and non-Indigenous guy talking about sort of Canada as a whole, and I think that one of my friends is a faithful listener, sends me a text every time that she hears everything, and then just sort of gives me a play-by-play of her thoughts through the entire podcast.
Yeah, that's really nice. I want to be clear. The majority of the feedback we've been getting is positive, and that's that's incredibly encouraging. Because you would think that just sitting in front of a couple of microphones and yakking would be really easy work, but it's actually remarkably difficult to pull this together.
It's a lot more work than I thought.
Yeah, so fool me once. No, but there, every once in a while, in the midst of our genuinely sunny experience, there's a ray of darkness, if that makes any sense.
A ray of darkness. Well, and it mostly comes in the form of an email late at night with some anonymous responding email address or something or other.
Yeah.
I remember my very first couple weeks at the Free Press, I got a picture. They had cut out my tiny picture, the little tiny picture that they use in the paper, drawn a Hitler mustache on me, and it was just F-U-C-K. That was the only thing they wrote on, and they actually took the time to put this in an envelope and then mail it to me.
Well, we will applaud the reader's sense of economy.
They actually spent money on a stamp.
Well, you see, that is old school. A lot of the stuff I get is email and Twitter. A week ago, I got a tweet aimed, like after I had tweeted out a new episode, came back, and all it said was, once again, a master of economy, said, Lone Ranger, =, racist. And, and I immediately, I think I mentioned, I was reading it, and, my wife was sitting at the dining room table, working on her computer, and I said, I am dying to ask this guy what he means. Like little context, please, or, like Jon Stewart, go on. And she looked up at me, and it was one of those, like, yeah, you do that, and you're single again. So
I think we need to give some classes, maybe some lessons. Maybe we should do this as a segment every week. Some lessons on what is irony.
Oh man, the possibilities are almost endless. But it really, let's be fair to our listeners. Okay, let's start with something more accessible, like. Why does the Lone Ranger make you creep out? What is it about the Lone Ranger that makes you creep out?
Well, so that always stops for me when I show people the picture of the podcast and then what we drew it upon, which was an actual picture from the Lone Ranger in Tonto, and we recreated that image in our multi-billion-dollar Free Press studios, which is I think a dark room in the back that we had a lamp in.
That's right.
But I want to share something with you, Dan. I got a voicemail.
Wow.
It was in response to some of the work that we're doing, and I just want to play a little clip for you right now. I've got full technological. I've set it up with Adam. Adam, just play a little clip of what I'm calling my biggest fan.
Okay, here we go.
Sad part of this country is we as the voter used to have control and say in what happens in government, but no, it's unions and special interest groups have the power now. They're the ones that dictate what laws get passed, which legislation gets read, what goes through Senate, and then gets passed into official law. It's a large country, it's a vast country, and a lot of different views. And the West has no time for the GTA voter or the swamp out there in Ottawa. Charter rights, as far as I'm concerned, throw the thing out. It's useless. It just helps those special interest groups and unions that control the government that they want in power. This country does not work anymore. It's not working for every working class or even a retired Canadian across this country. And then the West feels nothing more than just a resource colony. Always have been treated that way. So Ottawa, you Liberals and the NDP, you assholes can have your government and stuff your charter rights up your ass. We will go it alone if we have to. Bottom line is, it.
I am speechless.
Wow.
Yeah,
I didn't think I'd have to break the bleep machine out quite so much.
Yeah,
but
thank God
there
for
it
the bleep
is.
machine.
All I can say is the charter's in trouble.
Well, in certain parts of the country, the charter's in trouble, and and that is one of those hey, dude, man, don't hold back. Just tell us what you think, what you really think.
Yeah, that guy's passionate.
Yeah.
He's passionate.
Well, so this is a good segue. The big news of the week was the release of a special commission inquiry into the use of the Federal Emergencies Act during the trucker convoy. Justice Paul Rouleau issued the report this past week, and it was a highly anticipated report because if Justice Rouleau had come forward with an analysis that indicated that the use of the Emergencies Act, which really is an extreme piece of legislation, but it was instrumental in removing the demonstrators from downtown Ottawa around Parliament Hill, that it could be, it would have been a seismic moment in the political narrative in this country, and who knows what it may have produced in terms of electoral results. Justice Rouleau went the other way. He basically said he was disappointed, almost like very emotive, about the fact that he didn't want to come to this conclusion, but that it was in fact the right tool for the job.
And he says that any other reasonable person could have found something different, which is also an interesting way to kind of, the word diplomacy, I think, in this presentation is something that's many people have commented lots on. I think I was on Power and Politics, and Paul Wells called it one of the sort of most middle of the road inquiry findings you could have ever imagined. I mean, because what he did is he spent a lot of time, lauding the government, saying that they did the right thing in this scenario. And then he also made out a bunch of bad actors, Doug Ford in particularly for doing nothing, and then the Ottawa police for creating the situation. But then he also said that some other reasonable person might have found a different conclusion. And that's an interesting finding. Most inquiries, when you come out with the finding, this is what it is, and there's no other way to think of it. In the opening words, he said that there's multiple ways that you can see this particular act, because it's kind of such an archaic act, and it leads to 56 recommendations. This is like it would make your bookcase sag. It's 5 volumes, 2,000 pages. 56 recommendations, and it's broad ranging. It talks about the failure of federalism, the failure of federal and provincial departments to work together, the failure of policing systems, the RCMP and the Ottawa police to talk to one another and then come up with a plan. And then, of course, the much well-known issue that I think the Ottawa has with Doug Ford, and the fact Doug Ford just decided to go to his, famously go to his cottage during the middle of all of this and just ignore it and make sure that, it was left only once he took action when it was the bridge in Windsor.
Yeah, it's, again, I think I like the analysis because it does not applaud the government for using the Emergencies Act. It does acknowledge that it was a necessary evil at the time with all of the preceding failures. And, I think probably for law enforcement in this country, we had never had, not since the 1970s, really. We had never had street-level protests or violence or demonstrations of this magnitude with this kind of a threat, really, since the FLQ crisis in Quebec. So I think there was a steep learning curve, to a certain extent. But, I always felt all the way along, too, that the expectations that police could have been more aggressive and more, earlier. I also think, though, that the protesters were looking for violence. They were looking for a reason.
So, yeah, certainly some of them. There were lots of people, and I think that one thing that's come out fairly clear is that there were a lot of people who came there with some pretty legitimate beefs and perhaps were inflamed by the Prime Minister calling them a fringe minority. These were people who felt genuinely disenfranchised because of a vaccine mandate for truckers particularly. And, I've come out very harsh to say that's a very selfish approach, but I also appreciate that it's a democracy. Yeah. You're allowed to have an opinion and you're allowed to express your opinion. This inquiry was so extensive and quite impressive in lots of different ways. I mean, everybody got their say. And I mean, the residents of Ottawa were actually the ones who got the least amount of time, who were the most impacted, but they got the least amount of time. Meanwhile, the convoy organizers, people like Pat King and so on, got a whole week on a national platform. I mean, there was no free speech being stomped on there. You were allowed to speak on the national news every single night and have your views shared. But in the end of the day, it came up with some very simple recommendations like update the Emergencies Act, and then the rather absolutely crazy idea of having a national coordinator when you have an emergency.
You can hear 100 palms slapping 100 foreheads at the brilliant simplicity of that.
If we have a national emergency, we should have some organization and somebody at the head of that organization in charge, making decisions, working with all levels of government.
Yeah, I want to get to Pierre Poilievre's reaction to this in a minute, because it's key to what's happening in federal politics. But, his comment about the failures of federalism were the most poignant for me, because it really is. It demonstrates how, the convoy was erupting in different communities. You mentioned the bridge to Windsor. There was a fairly significant protest both in downtown Winnipeg and also at the border crossing in Emerson and in Alberta at a border crossing. And you know what? Like if the federal government and provincial first ministers, if they're not on the same page about what needs to be done, then I doubt there's going to be an opportunity for us to be more effective at dealing with similar protests in the future. I mean, in Manitoba, as we well know, the Premier of Manitoba, Heather Stephenson, on the one hand, was really condemning the federal government for a lack of action, but on the other hand, wanted to condemn the federal government for the use of the Emergencies Act. And, Doug Ford basically, became like the Groundhog Day. And I don't mean he didn't play the Bill Murray part. He played the groundhog. So,
Ontario's trying to take a bit of credit. Once they saw the results of the inquiry, Ontario was trying to say, Doug Ford's government was like, well, we called the emergency first. And, but yet you didn't do anything about it. Yeah. And in fact, you were a hindrance, if anything. And then you refused to testify.
So Pierre Poilievre, the Conservative leader, has, he has danced a very fine line between trying to court and support the convoy organizers.
Bringing them coffee, standing with them for selfies.
And I think the idea that the federal government overreacted or treated these people unfairly or illegally, which if that was the risk, is if Justice Rouleau had come out and said it didn't meet the threshold, then it was essentially an illegal act, an invocation of the legislation. So his reaction was really great. And I think that I want to be careful about how I present this, because Mr. Poilievre, who is not a friend of the podcast, and by that I mean his office continues to refuse my.
I was going to say, but has been invited to be a friend many times.
Hold tight. Is not yet a friend of the podcast.
Is not yet a friend of the podcast. And yes, for those people who in Mr. Poilievre's office who are listening to this podcast, I just want to let you know, I will still send you emails every week. Inviting you to be on the podcast, and we'll leave it at that. But anyways, his reaction was pretty hilarious. I think we've underestimated his comedic chops. Quote, "The only reason we had this emergency is because Justin Trudeau wanted it to happen. This was an emergency that Justin Trudeau created by attacking his own population." Okay, so what's funny is if you took that quote, it doesn't sound dissimilar to some of the testimony from Pat King and the other convoy organizers. So, I think that a lot of the political scientists and other people reacting to this believe it was a 100% win for the Trudeau government, and there was no downside. Like some of the comments that I read from political commentators, not necessarily from columnists, but from pundits were ridiculous. There's always a downside to a story like this, and the downside is that the people who are angry enough to drive their trucks to occupy cities and angry enough to shut down Ottawa, they're even more pissed off. If it were possible, they're even more pissed off.
The acrimony and the rancor, I think, is at full force now. And if there's one thing that I think, the thing I noticed most about the Pierre Poilievre press conference is that he spoke for 7 minutes in French at the start. Yeah. And I think that's interesting. I mean, he refused to speak English for a very long segment. Normally, most federal politicians, they usually start with English, or what they do is they'll go French, English, French, English, French, English. Yeah. That's not what Poilievre did. He started and did 7 minutes in French, which tells you a lot about who and what's happening within that party, where are they trying to appeal to. But then also the fact that, and there was many parts of the Ottawa convoy that came from Quebec and that had very significant roles to play there. But if Poilievre's tagline is, which is what the press conference tended to be all about, he gave a litany of things that have happened during Justin Trudeau's reign. People can't buy a house. People he even blamed overdose deaths. He even blamed long lines in emergency rooms, which is absurd because we're talking about premiers here that are governing these systems. And it's not Justin Trudeau's, as in fact, we saw Justin Trudeau this past week give $46 billion to premiers. So he's doing something anyways. I'm not telling you that's perfect, but it's something. And so this tagline of everything is broken or everything feels broken, that's an actual tagline that it seems that he is going with on full double down. Everything is broken, everything is broken, everything is broken. Well, this inquiry report seems to tell you that, yes, federalism is in trouble. Yes, policing doesn't seem to work very well. Yes, we don't have basic things like a national coordinator, but democracy seems to be just okay. It seems to be just fine. It's not broken. In fact, it's probably stronger now because of an act like this. The fact that for 6 weeks, Canadians witnessed a massive expression of divergent opinions, and some of those opinions, most Canadians are dead set against.
Yeah. I mean, remembering back to the angry man, as we now call him, who
also called my biggest fan.
Well, if he keeps sending you messages,
he's clearly very passionate.
Yeah. I had a guy, as an aside, here in town who used to email me all the time. And at the time he was emailing me, he actually had a show on a radio station sponsored by a post-secondary institution in the city. And and it was like I kept some of the emails because like people don't believe how vile some of the stuff that we get is. And like he wanted my family to contract fatal diseases, and he talked about leaving defecation like around my house and on me, and so I think the thing that I worry about the most, and I think back to your angry, robust fan, is this, but it's this idea that on this topic, we can't have civil discussion. So I agree with you completely that democracy is alive and well. Like we're having a debate about this, vigorous discussion about this. But the problem is that it's like there's no, like with a lot of my readers, if they engage me in a relatively civil fashion, they know I'll write back to them. But like if it starts out like you're an embarrassment to journalism, your newspaper's an embarrassment.
That's just my emails.
Yeah, that's right. Yeah, but I'm being healed through the magic powers of the podcast.
Well, no, I mean, yeah, absolutely. I mean, the problem is we don't listen as much as we speak, as my uncle would say. Yeah. I mean, we're supposed to be listening twice as much as we speak, and I think that's the main problem. Speaking of
listening.
We have an amazing storyteller. As soon as we had seen her way off at the Grammys down in Los Angeles, you texted me right away and said, we need to get her on the podcast. And so I did. So I a few texts later and a few messages later, I got Rhonda Head, who is a well-known Cree soprano singer. She's very popular on radio stations across the country, and she is also a recording artist with I'm not sure what they call it, but it's the American Recording. There's
the Academy.
The Academy that you have to have, and so she went down to the Grammys just a few weeks ago. Very proud Winnipegger, proud Jets fan. Showed off her colors.
Yeah.
Anyway, so I won't spoil the story, but I hope that you enjoy it. And we got a great feature interview that you and I did just a little while ago.
Yeah, you're like, this is the Niigaan as Rainmaker episode of the podcast, right? So I'm just kind of sitting back and, who else do you know that's interesting? So, you had become sort of chummy with former Liberal MP, former Liberal Cabinet Minister Jane Philpott, who was also a central figure in one of the Trudeau government's early, most vigorous
scandals,
controversies,
yeah,
definitely controversy, and she's also an incredibly thoughtful. She's a physician and has both a politician's and physician's view of the debate we're still undergoing about the fate of national health care.
And we caught her just after the announcement of the healthcare agreement or the funding that Justin Trudeau and the federal Liberals are currently negotiating with the provinces over $46 billion of new funding, and then several $100 billion more of mandated funding for federal health transfers. So she's got really interesting insights. I wrote actually a column to talk a little bit about the challenges of what First Minister conferences, which is when the Prime Minister and the Premiers meet, and who's not at the table. So I hope people take a look at my column as well. And I quote Jane in that. But without further ado, let's turn it over to Rhonda and then hear from Jane Philpott.
I'm Rhonda Head, and I am a Recording Academy member. This story is about a Cree woman that went to the Grammys. I was walking around Polo Park the day I left for Los Angeles, and I walked by the Jets gear store, and I walked in there and I said, I want a Winnipeg Jets flag, and I bought it, and I told the guy at the register, I said, I'm going to show this flag off at the Grammys. And I don't think he believed me. The day of the Grammys, we got up early. We started getting ready, got our hair done, got our makeup done, put on our dresses. And it was the pre-Grammy Awards. So we walked, it's a separate building where they have the pre-Grammy Awards from the show that's televised. We arrived early. And when we got there, there was so many security all over the place. And then we got shooed into this one line, and we were meeting so many people from all over the world. And most of the people that we were talking to were all nominated for a Grammy Award. And the one thing too that was, I thought it was pretty awesome. One of the musicians recognized me. He came up to me. He goes, Rhonda? I said, yes. And he goes, we follow each other on social media. I went, oh, well, so great to meet you. And so we got our photo taken, and so that was such an amazing time. You could just feel the excitement in the air. And we found out we were in the wrong line. We ended up lining up where all the Grammy nominees were lining up. So all the musicians we met were all Grammy nominees. So it was so much fun. And then we got to meet so many other musicians and other Recording Academy members. It was a lot of networking, so much fun. I got to hang out with some of the Indigenous Recording Academy members as well. We went walking right up to the stage, and I pulled out the Winnipeg Jets flag, and I got my photo taken with the Grammys backdrop behind me, and some of the people in the crowd were like, "Hey, is that the Winnipeg Jets?" And I went, "Yes," and I waved the flag around again. It was so much fun. I also want to tell a really quick story about the Grammys that happened last year in Las Vegas. we got invited to this really cool after party at a casino where Elvis had his residency there before. It used to be called the International Inn. Now it's called the Westgate Hotel. So we went there, and it was on the penthouse, and it's called the Barry Manilow Suite. And it was so awesome. Like, there was a buffet of food. There's a piano player playing a beautiful white grand piano, and there's people signing up to sing. So I signed up to sing. I sang at last. It was pretty cool. People were dancing when I was singing. And then we started roaming around the Barry Manilow Suite. It was huge. And then I walked by the pool, and I slipped and I fell in. And I was wearing my gown from the award show, and it was so crazy when I was falling in. I was thinking, as if I'm falling in this pool right now. So there you go. I made a splash in Vegas, and at least my name's getting out there, right? So that's my Grammy experience. From Opaskwayak Cree Nation to the Grammys in Los Angeles. This is when I knew this Cree musician could take over the world. I could say.
All right, welcome everybody to our feature interview today. We are so pleased to have not just a physician, former member of Parliament, a former cabinet minister, but also former Winnipegger, Jane Philpott, who's joining us on the Niigaan and Lone Ranger podcast. Thanks for coming with us on the trail there, Jane.
I'm so happy to be on the trail with you.
We're so happy to have you, and of course, one of the reasons why we were able to bring you on the podcast here is you and I hung out at the Governor General Leadership Awards about 8-9 months ago in Ontario, and we met. We were on a panel together, and I quickly asked you if you could do a podcast in a couple weeks, and here we are now 8 months later. So that's how well organized we are.
It's worth waiting for this conversation, I hope.
Okay. Well, we want to, not many people, I think, in Winnipeg and Manitoba might know what you've been up to since your political life. And now you're at Queen's University. And maybe if you could just take a brief moment and tell our listeners, what have you been up to, since having a very high profile job as, minister in Liberal government, federal Liberal government. What have you been doing since?
Well, thanks for asking that. And again, thanks for having me on the show. As some of your listeners will recall, I had a wonderful opportunity to serve the country in the government from 2015 to 2019. My political career came to a rather unexpectedly abrupt end in 2019. I did try to run again as an independent, unsuccessfully. So that left me to try to figure out what was next. Thankfully, I had a previous career that I could look back to. I'm a family doctor and also had taught at the University of Toronto in their Faculty of Medicine. So I was exploring ideas around both medicine and medical education, and got the wonderful opportunity to become the dean at Queen's University. We have a Faculty of Health Sciences here, so we train doctors, nurses, OTs, and PTs, and it's my great pleasure to help do all that work. And it's a really important time to be in the business of training health workers. So that's what I've been doing since 2020, and really enjoying it.
And I don't think a lot of people know that you have a very long, lengthy experience overseas, and particularly in Africa. And I think that's interesting that people might not know about. Then, in so many ways, and the term third world is never really appropriate, but I mean, it does give a kind of way in which we understand that there's certain sicknesses and health issues that are in other parts of the world that Canada hasn't dealt with. in for quite a long time. Interestingly enough, of course, many of those things are coming back on First Nations. And so you've also done lots of work with First Nations. Not only were you the minister for Indigenous peoples, but also, you worked with Anishinaabe Oski Nation. And I think that's interesting. People might not know a lot about that. Do you work on First Nations? What's the connection between health work on First Nations, health work in Africa?
That's a great and interesting question. So you're right. Our family spent about a decade living in West Africa in a country called Niger, or the French would say La République du Niger. It's a large country, most of which is Sahara Desert. We lived in the bottom part of the country, which is the habitable part. It's one of the poorest countries in the world. And we lived and worked at a little rural hospital 500 kilometers from the capital city. And I was introduced there to a real life understanding of what makes people sick and what makes them healthy, and to realize that it's things like climate and geography and poverty and lack of access to education and geopolitical forces that are actually the biggest determinants of people's health. And so I think that was interesting in terms of my future work, particularly work with Indigenous peoples who are faced by some of the same reasons that cause poor health outcomes. But the other thing, in a more positive light, I would say from that is it exposed me to learning an alternate worldview, and a worldview that had a lot to teach me. I've often thought about communitarian decision-making that I witnessed in villages in Niger, where we went to work on training village health workers, and understood that if you were going to implement a training program, that it needed to be introduced in a particular way and with the support of the chief and council leadership of those communities, and that we would have large community meetings to be able to decide whether or not they were interested in getting community health teaching. So I gained a lot of respect for the way that decisions were made in those communities. And I think it helped me many, many years later when I had the privilege of visiting many First Nations communities across the country, as well as some Inuit and Métis communities. And I recognized some of the perspectives that, of course, were different, but that the concept of making decisions as a community was something that had always struck me as a sad impact of colonialism, that it had taken away looking at that alternate way of making decisions together.
So I just want to. By the way, I'm here too. I'm Dan, and I'm like
he's on the trail as well.
Yeah, it's I know there's kind of a love-in going on here, but I'm here too to ask questions and welcome. So I noted your comment about your unexpectedly abrupt end to your political career. And before we get into that, I actually want to ask you a little bit about why you got involved in politics and all, at all, because I'm always somewhat fascinated, and I think medical professionals tend to fall into this category. People that have accomplished so much, they've become leaders in the field of medical science or medical services, and then they want to get involved in politics. And I'm just wondering, what was the decision-making process? Who approached you, and how did you make the decision that you wanted to jump into electoral politics, which is, pretty rough and tumble world?
Yeah, thanks for the question, Dan, and I'm glad you jumped in. There's a long version of the story. I'll try to tell you kind of a shorter version, but people go into medicine, I think, wanting to try to think that they're going to make people healthier. And you can do that as a doctor, one-on-one, one patient at a time, sometimes a family at a time. But after a while, you learn the things that I was referring to earlier about the fact that actually doctors can only fix so much, right? By the time you see somebody, they're pretty far down the stage of whatever their particular illness might be. And if only we could have backed up the interventions in that person's life to make sure that they had food on the table and a decent education and a decent place to live, that actually they might not have ended up with that illness in the first place. And so I, right from the time that I spent that decade in Africa, started thinking about all of that. And then got particularly involved in some specific areas of work like HIV, which was something that was an issue that was on our minds when we lived in Africa, and got involved in fundraising for HIV. This is all coming around to answering your question, but through my HIV fundraising work, I had a chance to meet former Prime Minister Paul Martin and have coffee with him, which was a huge privilege for me. And I had this conversation with him, which I learned he has had with many other people later. And I expressed to him my frustration at the system and all of the things that were wrong with the system that meant that people around the world didn't have fair access to healthcare, et cetera. And I made the mistake, I guess, of making an offhand comment to him where I said, someday I'd just like to get in there and change some laws, change the way we do things in this country because it's making people sick. And he said, what? Did you just say you're going to run for office? And I said, oh no, that's crazy. I'm a family doctor. I got 4 kids. I got a busy life. And he said, no. If you are even thinking about it a little bit, and if you could actually run and get yourself into office, maybe get around a cabinet table, he said, you could fix some of those things in 10 minutes. And all your ranting about it on the outside will take years for you to see change. And that was like, boom, a light went off in my mind. And I thought, oh, that's where the levers are. That's how you do things. So I just started working away at it. And 5 years later, I was elected.
Well, having the Paul Martin, seal of approval is not the worst way of entering electoral politics. And I've interviewed him a number of times, and he's oddly inspiring. Like, he's kind of, I'm not sure he ever made the best guy to run the country, but he's pretty passionate about public service. Okay, so you're aimed at changing the system. Now, it should be noted that, like, when you decided to run for the Liberals, it wasn't like a lock that you were going to be in government. The 2015 election was quite a thrill ride. So why at that time? I mean, obviously, Paul Martin, I'm sure, had some influence on it. But was it just, were the Liberals the obvious camp for you to set up in?
Another really great question. So I had not been a partisan. I actually think most Canadians don't really fit into any one party perfectly, right? I'd like to try to see some good things in all of them. Some of them it's harder to find the good things, but and some things I disagree with in all of our major parties. But I did decide I was frustrated. Those were in the days, latter years of Stephen Harper's government, and I was upset with some things he had done around refugee healthcare, et cetera. So I wasn't going to sign up with them, and the Liberals had been kind of wiped out in the 2011 election. But I thought, well, there's a group that's going to try to rebuild. I'm going to sign up and see if I can help them rebuild. So you're right. We didn't know where it would go, but I was very, very blessed that it turned out in a good way.
It's funny. I also received I received phone calls from Paul Martin. He used to phone me all the time. And, you used to read my articles. And this is way back when I was still just a PhD student. And one time he was stuck. Remember when that volcano in Iceland grounded all the planes in the world for a while? He phoned me from Iceland, being stuck there for a week. And apparently he spent a portion of that week reading my articles, my academic articles, which is very weird. Yeah. So, I mean, there's lots to say about Paul Martin, but I was very, very impressed by that he was reading all these different things and just getting up to speed on things. I think most people know about the meltdown, implosion, issue, whatever we want to say, in terms of the way in which he left the party. But was there any signs of a fracturing of that relationship with Trudeau's leadership, with elements of the party? I mean, you served many posts: the Minister of Health, Ministers of Indigenous Relations, Treasury Board. You held many very senior, important public posts. Were there signs of things going wrong before 2015? Or?
You mean before 2019?
Oh, sorry, before 2019. Yeah, so from 2015 to 2019.
I don't know that the events of 2019 were entirely predictable until just before then. I mean, there's always give and take around the cabinet table, and all the decisions that were made there were not all ones that I would have necessarily been my first choice, but you're required to do a little bit of compromise along the way, be a team player to the extent that you can, and walk out of that cabinet room of one mind and solidarity, even if it's not exactly what you would have wanted. So that had, with a few exceptions, that had gone relatively well. But as you said, I a bunch of things happened during those years, and one of them was that I, especially because of my work in both health and Indigenous services, I spent a lot of time really embedded in thinking about issues of Indigenous rights and the recognition and implementation of those rights. And I had a really great teacher, and the teacher became my friend, and that was Jody Wilson-Raybould, who was the Attorney General and Minister of Justice. And as a result of watching what those conversations were like around the cabinet table, I think that's where I started to wonder where things were going to go, because as you know, she is an outspoken champion of the recognition and implementation of Indigenous rights. And there were times that message was not one that people wanted to hear. And then, of course, without going into all of the detail, there was this whole matter of her being pressured to intervene in a criminal prosecution. And it was for me, something that I couldn't sit idly by. In part because I feel extremely strongly, as I would hope all Canadians do, that politicians don't interfere with the prosecution. There's a very clear delineation of powers, and what happened was wrong, and it was later proven to be wrong. So that was something I couldn't maintain solidarity about. And then, of course, as I've talked to you about as well, Niigaan, I couldn't sit idly by while Canada's first and only Indigenous Minister of Justice and Attorney General was treated in the way that she was, and where she did the right thing and was pushed aside.
So I think obviously in real time, the reporting on this, and I'll do the very, very micro background. SNC Lavalin, Montreal-based engineering firm, criminal charges of corruption, negotiations on a resolution of the case, and initially the federal prosecutors wanted to prosecute the case. And the Prime Minister's office felt that they had created a piece of legislation that should have allowed for a plea bargain. And in the middle of all that, the Attorney General was pressured to intervene in the case. Okay, so that's the messy background of it all. Right now, I'm going to ask you another question about 2019. But I mean, right now, the Liberal government is facing sort of a watershed moment. It's actually Prime Minister Trudeau is actually he's been governing now for quite a long time. Like, he's about to get into that very long time period. It's a minority mandate. They're running behind in the poll. Liberals are running behind in the polls. The government continues to seem to have a whole host of problems that seem to be tied to judgment. If we look back to 2015, and I ask you how much of what happened in 2015 or 2019 that derailed your political career, that forced you to make the tough decisions that you did, how much of that is due to the Prime Minister and the culture of the government he created? Prime ministers are not always responsible for everything that happens in a government, but I think the culture of the Executive Council, of the relationship between the First Minister and cabinet ministers, I think that is 100% on the. So would you say, like, is it really, Mr. Trudeau's influence that really was the spark to that whole fire?
Wow, you guys are asking hard questions.
Yeah.
Let me try to be as discreet and diplomatic as possible while trying to answer your question as well as I can. And I'm just going to kind of explain that in part because I have tried since I left government to be as nonpartisan as I possibly can, and to be as positive about what people are doing right, and not necessarily tear down people who I think need some critique. I'm also cognizant of the fact that I have a major role at a university that depends upon public resources from all orders of government, and I would not want to say anything that would undermine the support that our university gets from governments. So
Jane, if anybody messes with your funding, we're on that. Okay. They're going to have to deal with us. So
I'll tell them. I'll say, you canceled that because of what I said. Anyway, so that's I just want to make sure your listeners know that's kind of where I'm coming from. So, and that's why I will be a little bit discreet. But I think the patterns of sort of a high level command at the level of the First Minister in the country have been developing over a long period of time. So I don't think we're going to just attribute this to the current leader. We know that his predecessor was accused of the same thing, where power was centralized in the Prime Minister's office. I wish it didn't have to be that way. I don't think it has to be that way. I work here in a system where I've got 5 vice deans that have different kinds of roles in the faculty. I sit down with them as a group on a weekly basis, as individuals almost every single week. I get their advice. I give them the liberty to run their particular portions of the program. And, those are the right people that need to have that authority and from whom I need to get my feedback. It's not exactly a comparison to what it looks like to have a prime minister and a cabinet, but I think that we've gotten to a place where cabinet ministers are under a lot of control, often by unelected officials, and where there's not a lot of abilities to get smart outside advice. And I don't think that that's the best way to run any organization, let alone a country.
I think a lot of people do draw parallels between business leadership or public sector leadership, and the centralized control that a first minister and their staff has. So I'll press once more gently on this, though. If people identify the great flaw of the Liberal government right now, it's the fact that they don't seem to be able to anticipate like all the possible outcomes of the things that they do. So hence, legislation has to be withdrawn or heavily amended, or people say things and then realize they've said the wrong thing and they have to walk them back. I think in journalism, we often we lay too much responsibility at the feet of the First Minister. I mean, it's just one person. But the one thing I would sort of say, like in what you described, the culture of it, though, is created by the First Minister. So, I mean, if people think that this prime minister has too much control and maybe doesn't listen to cabinet ministers as much. Is it really unfair to sort of say that Prime Minister Trudeau is the author of that culture?
At the end of the day, the person at the top sets the culture, right? So I think that's not unique to the current federal government. We see it in provinces across the country as well. I don't think it's in the best interest of Canadians. I think a more inclusive, open, listening government would serve us better. And I think, you nailed it when you talked about the fact that there's something going on when major pieces of legislation get out the door, and then there's a huge backlash, and then everything has to be either scrapped or completely overhauled, to sort of say what went wrong in the process that it got this far without realizing how problematic the legislation was. So that seems to have happened again and again, and it strikes me that there's something with the listening side of government that's not working.
I know that you're walking a fine line here to think deeply about what your role is in the events of 2019. I think what we've talked about on the podcast a number of times is there's certain elements within the current federal Liberal cabinet that reduce diversity or don't include certain elements of the country. And one of the most important thing, I think, is that most of the major cabinet ministers are urban, and there's not a lot of rural voices. And then, of course, the whole idea that you would remove two extremely strong female voices that we need to be at a table. And yes, there are other females, but we're the important role of what in our Indigenous world we would talk about our sisters and our aunties who are vital, and of course there's our grandmothers who run the community, and that we should be thinking about them at the front and not just because they say something we don't like. And then, of course, there's all the other things that go into the relationship between the federal government and has turned quite rancorous with the provinces. And that's what I want to turn to and pivot to. Here we are. We're not out of the pandemic, but we're certainly on a different element and a different track of the pandemic. Now, almost every single healthcare system in the country is in crisis. I wrote a piece recently about my father's experience in the emergency room here in Manitoba and how atrocious it is and what a nightmare it is. Large part of that has been because of provincial decisions, not federal decisions, but the provincial governments are saying money, money, money. So Tuesday, the great offer, and I say the great offer because, never has there been more anticipation for a piece of paper slid across the table than it was on Tuesday. 196 billion over 10 years. 46 billion of that is completely unplanned for. It's just brand new money that was not previously budgeted. You're the former Minister of Health. Do you see that over 10 years as dealing with some of the major issues of healthcare in the country? And then the second question is there's been all this talk around deliverables or particular strings attached, as Quebec would call it, as Francois Legault would call it, the expectation that the federal government can make on provinces to where that money will go. Do you think that this is a good step in a direction, not enough?
So it's been, decades since there's been as much hype around a potential health deal as we had this week. And of course, it's particularly on the minds of Canadians because we've just come through the worst of this pandemic, which has not only, led to the death and disablement of a large number of Canadians, but it has wiped out huge parts of our health workforce. And those who are left on the front lines are exhausted and demoralized and thinking of leaving. So it's never been more important for our leaders of the country and the provinces to get it together. I was disappointed with the deal that was offered. And it's not about what the dollar value was. That, was it the right number? Could have been more. What I was disappointed at was the lack of vision. that there was really nothing in the deal that was offered to say, we could do things differently. Here's what health workers and health policy experts have been telling us would make the system better. And we had a chance. Like, the appetite's been there in the public, and there's new money going into the system. So I'm not sure if you've heard any of this conversation around primary care or lack of access to family doctors, but there's data out now that 6.5 million Canadians don't have access to a family doctor. And I'm sure lots of those people in Winnipeg that don't have access to a family doctor is partly because we have never designed our systems properly that way in Canada. And several of my colleagues and I have been advocating around the concept that in this country, every kid has access to a public school. We would think it was appalling if we had 6 million kids that couldn't go to public school because we hadn't figured it out. That would be absurd. Why can't we do the same with primary care teams, right? Why can't we say, this is your neighborhood, we're going to have a primary care team in your neighborhood, and it's going to be open 7 days a week. And when you move into our neighborhood, that's where you're going to go get your care. That is actually doable, and it will cost less than what we're doing now, because all those people that don't have a family doctor or other primary care home are going to emerge, or they're not getting their care, which means they're getting sicker and not getting their cancers and everything else diagnosed early enough, or else they get into hospital and they can't get home because no one will take care of them at home. So we actually had a moment this week when the premiers and the prime minister could have said, we are going to put all this new money in, and it's going to be used so that 5 years from now, every Canadian will have a primary care home. We saw nothing like that. We saw, here's a few things you could work on, pick one of these 4, here's a bit of extra money, let us know what you're going to do with it. But how is a Canadian supposed to know that something's going to actually change? And if they're waiting 18 months to see a specialist, how is that going to fix anything for them? So I'm not sure. I think I've probably gone a bit off where your question started, but we've lacked the leadership, and it was when Canadians were holding out hope that maybe there was good news, they didn't get it.
So, horrible admission on my part. I'm an incredible Kai-Hi nerd, the Canadian Institute for Health Information. So, I spend hours trying to figure out how their online tables work. There should be a separate post-secondary course on just operating. It's very complex. But anyways, it's supposed to be the national database for measuring healthcare outcomes. And, the one thing I've learned in tracking Kai-Hi is that it's not a national picture at all, because every province has a different system of tracking data. Some provinces don't even report on the major metrics that Kai-Hi tracks. So, and I know, you've commented on this, one of the issues, which is data collection, which could be kind of a gateway to setting targets, right? So we ask, provide the money, and then Ottawa asks the provinces to, report back to us on the following outcomes, show us that you spent the money where you say you're going to spend it, and then once we get the data, we'll know if the money is producing the outcomes. And successive prime ministers have been afraid, I don't even see that as strings, because we're not telling them how to spend the money, we're just telling them that they should tell us how they're spending the money. So why talk about the importance of data in healthcare funding, and then why are politicians so afraid to make that globally make that request to the healthcare system?
Okay, this is great. So first of all, congratulations on being a Kai-Hi. It sounds to me like you should be getting a PhD in Kai-Hi analytics, because it is tough to go in there. You're a brave person if you go in and try and figure things out.
I have way too much time on my hands. That's why I do a podcast now. So
I would say a couple of things coming out of your comment. One is, yes, absolutely, we need a national database that is reflective and allows us to answer the questions across the country, and we don't, because there aren't national standards and there's not there are no requirements for interoperability. And I agree with you. I'm like, why are we all being so nice to each other? Why doesn't somebody just say, the feds are the ones that should say it? And if they're, given that things like privacy and security are a no, there's no options on those have to be into the system. But given that, there needs to be sharing of data, and there needs to be agreement on the definitions of those data. I think we're getting closer to that, so that will help. But you're right, that should be non-negotiable. Like, that's doesn't even need to be discussed. There needs to be a national database to be able to look at a bunch of things so that we can figure out if we're getting better or worse on whatever it happens to be. As it relates to something like a big health accord like this, though, I've been thinking that CIHI is the place to actually do the under the hood metrics and see how things are going, but not everybody does what you do, Dan. And so the average Canadian is not going to go look at CIHI data and say, did mental health care get better in Manitoba? Or is there better home care in Saskatchewan? Like, it's just too complicated to figure that out. That's why we need like really obvious deliverables. Do you have a primary care provider, a home, a family health home where you can go and get your care? And people can say, not me, not yet. Like, it's pretty easy to say whether you've got that or not. And if we can make those kind of universal commitments that will be very clear to everybody where we're aiming together, it will allow us to be not just one government to another to hold one another to account. It's Canadians who should be holding the governments to account. It's our money, after all, that they're using on supposedly on our behalf. So I think trying to set targets that are easily understood. Do you have access to care or don't you? And then to have mechanisms to say, if we're not getting that, here's where I can go and report that I don't have access, and you guys better fix that.
So if I could get you to put your politician's hat on, if you remember where you've stashed that. So the politics of it, though, are quite fascinating. So I'll give you very briefly my theory about why prime ministers are afraid to say, okay, you can't have Canadian health transfer money unless you show us where you're spending it and produce the following data points. Because I don't think it's an issue anywhere else but Quebec. I think the rest of the country, like in places like Manitoba, Saskatchewan, Alberta, British Columbia, Ontario, it's like, data, strings, I just want to know how long I'm going to be waiting in an ER. But in Quebec, that point translates into a whole debate about Quebec autonomy and the right of self-determination. And so, am I investing too much political muscle in Quebec's influence on this? And if it's not Quebec, what is it that is making, what political issue is making prime ministers afraid to do what they need to do?
That's a really interesting discussion. And I think it has to do with political issues and wanting to get reelected and the power of Quebec in that regard. I do think, though, if I may just bring us back to Indigenous issues, it also has to do with sovereignty, right? So I feel very strongly about data sovereignty as it relates to Indigenous peoples, and that has been a barrier. I think governments are only now starting to get around to recognizing Indigenous rights when it comes to the sharing of data, and First Nations have done some really great work in this regard. There's a fantastic organization called the First Nations Information Governance Committee, FNIGC, I think. Not sure if I've got the initials quite right, that has really done a good job at trying to educate everybody about principles around data management and stewardship and sovereignty. So without suggesting that I completely understand the Quebec mindset, there is a sovereignty issue there as well, right? From a sense of, it's our data. But there are ways to get around that. I mean, we're having those conversations with First Nations leaders now to say, we respect your sovereignty to own and control your data. But given that, let's find an agreement between us to be able to share that, because the reality is we are sharing this land and space together. not always as well as we could. But we're going to have to find a way, because we are now sharing the land, that we need to share our data as well. So I think that might be an interesting framing for the conversation with Quebec.
But yet, First Nations are not invited to First Minister meetings and are constitutionally kept from being at the table, never mind all the other political ramifications. This week, what I said was, this is a perfect example, and I hope everybody notices it, that when you exclude First Nations from the table, not only do you actually keep some of the best practices of health in the country that's taking place. I mean, no one really handled the pandemic better than First Nations. I mean, we were willing to give up basic human rights, curfews, rights of movement, and in order to deal with the pandemic. So there's lots to learn there. But then also in Manitoba, there was data sovereignty for the first time, which was a direct a way of dealing with the pandemic, and therefore lives were saved. So it is, I think, very important that we underline that several times, that when you look at a First Minister's meeting like this, I mean, healthcare is an important issue, but of course, at the same meeting, they're talking about how do we deal with inflation? How do we deal with the issues of the United States offering tax exemptions to basically get themselves out of this inflationary mess that they're in? And of course, the answer to that is going to be what Canada will look at as lands and resources. Guess who you got to deal with for that? And so not having First Nations, Métis, Inuit peoples at those First Minister meetings is a perfect example of working backwards, or working almost impossible, because then what's going to happen is you get marches later when you make decisions without First Nations. So I hope people understand the connection there.
Yeah, that was a big miss this week, and really surprising, actually, but it has not. Our country has not yet been able to figure that out, and we're going to be stuck until that table can be a federal, provincial, territorial, First Nations, Inuit, Métis table.
Yeah, I wonder when that will be. But that's a conversation for another time. We've already taken up
Wait, just say, I've got 9 more things that I want to talk about here. I want to talk about, doctor salaries versus fees. I want to talk about unnecessary diagnostic tests, and can't we do we could do a part 2 and a part 3? No.
I feel like Jane's got to get to work here. I think she's given us more than enough, and I really appreciate you coming and joining on the Niigaan and Lone Ranger podcast, Jane. Thanks so much.
It's been so nice to be with you, and I'd be happy to come back anytime. Thanks for a great conversation.
There you
go. Yep, you're coming back now. Yep. Okay.
I want you to know that I'm now looking up what Kai-Hai is, and it's my brain.
It's okay, Niigaan. I'll get you there. Don't worry, I'll get you there.
Completely lost. Okay, miigwech, Jane. Thanks so much.
Miigwech. Bye for now.
And that brings us to the end of another episode of Niigaan and the Lone Ranger. I'd like to thank Rhonda. I'd like to thank Jane Philpott.
That was a totally amazing interview.
Yeah, no, it was. She is in the hockey parlance, she's a beauty. I think she would. I think she would appreciate.
I actually think she would appreciate that, having spent a bunch of time with her. She definitely is. She really knows her stuff, and then she's also just very approachable and down to earth.
Yeah, and Adam, you wanted to alert readers to one other thing that's going on.
So I feel like Columbo. Just one more thing before we wrap up this week. What's the status of Operation Arnett?
Oh, our campaign to get Canadian actor and fellow podcaster Will Arnett.
It's bated breath to hear where this is
going.
Well,
week 2.
I did. Not week. I mean, I started weeks ago. That makes
week
me sound
200.
This week I unveiled via Twitter the first 2 items in the VIP gift bag that we will provide to Will when, not if, he comes on the show.
I'm going to be broke.
Much like leader of the Conservative Party of Canada, Pierre Poilievre, he's a future friend of the podcast.
A future friend of the podcast. So the first 2 items are a fantastic Winnipeg Jets sweatshirt with the Indigenous-themed Wasuk designed
I want one
logo.
of those. Hold on here.
Yeah, I think you have one.
I have more than one.
You have more than one. That's right.
And what was the second thing? The second thing, actually, I was very excited about because
4 dozen. I only showed 2 dozen in the photo because it's Twitter. But 4 dozen frozen handmade pierogies made by genuine Ukrainian babas in a North End church. And in addition to the 4 dozen pierogies that I will make available to Will Arnett, I will also consider giving him my contact for the pierogies. My pierogi supplier is like the one thing about Pierogi Club is you don't discuss Pierogi Club, and now I've broken that.
There would have to be 3 contracts all signed in secrecy.
Yeah, so there are more things to come in the VIP gift bag, which, as we well know, is like standard swag to lure celebrities to events.
The problem with you telling, saying that we're going all out for Will Arnett, every guest that I ask now is like, where's the gift bag?
Ooh. And I didn't think of that.
You're creating a problem for me in when I go and ask people to be on the podcast.
I'm going to make a big tray of Rice Krispie squares.
Puff Wheat squares if it's from where I grew up.
Absolutely,
yeah. Exactly.
And I'm going to wrap them in cellophane with a little red ribbon, and we'll put that in a little free press bag. And so they'll think, but I mean, listen, like the big bag is for the big celeb. So that's just the
you're just digging a hole now. We'd like to thank CJNU as always, and our producer Adam for the great work that he does. This was a lot of heavy lifting this week, editing wise, and so just huge thanks to Adam, and of course all of our colleagues at the Winnipeg Free Press, our editor Paul Samin, and all the great support that he gives to us, as well as all the wonderful people who help us to upload this, the Free Press. Too many to mention, but great people who do everything from making sure that we look good and shiny to making sure that our podcast gets to all corners of the world, which is now listened to in 4 to 5 continents, which is pretty amazing.
Yeah, we're huge in Hawaii. We remain huge.
I don't know who's out there. There must be some expat Winnipegger.
Well, thanks to the Winnipeggers who winter in Hawaii is all I can say. and my apologies as well to Paul Samin for being Tonto's second victim in our soon-to-be-released slasher version of the podcast.
He deserves it. He deserves it. I'll just leave it at that.
I wonder what's going to happen to Silver, or is Silver going to be the last one standing?
Well, actually, let's not give it away, but in the bloody showdown at the end, there is only one 4-legged creature who comes out alive. I'm just going to leave it at that. So, thanks, everybody.
Miigwech, everybody. Take care.